My name is Bruce Slane. In this video, we're going to be looking back at the COVID pandemic, looking back at the past politics, how it was handled. Now, there are many people that are very angry as to how it was handled. Angry about the lockdowns, angry about masking, angry about censorship, about the mandates, about the cover ups, about the media betrayal, anger in general. And I hear those people. So let's get into this topic. Let's go over some important issues. But first, let me go through my background. My name is Bruce Slane. I'm a medical malpractice attorney in New York. I practice vaccine injury litigation in the Federal Court of Claims. I represent mesothelioma victims and their families. I'm one of the longest living survivors of mesothelioma. So, to start off our trip down memory lane of COVID and my analysis of some of the issues, I want to shed some light on something that moved me at the time that really didn't get much press coverage. And I think it's relevant because we live in times of war and people pointing the fingers at one group or another. And I'm a New Yorker who lives in Westchester County. And when COVID started, there was actually a military roadblock in a town next to where I live. And there was at least one doctor in my state who committed suicide because they couldn't handle the stress.
Extremely sad news. A top doctor who treated coronavirus patients in New York City died by suicide on Sunday.
There were frontline workers making masks out of underwear. And during this time, I saw this 15-second news clip on my local news channel, and it showed a plane filled with N95 masks, among other medical equipment, flown to the United States. And that was from Russia, and the plane landed at an airport about 35 minutes from where I live. That was a message from Russia, from Putin. Essentially, we're here to help. Now, I mean, the media buried that to a large extent and call me a Russian stooge. Say I'm just I fell for it. It was a stunt that I fell for. Well, people in my community needed those things. We did not have it. We needed those masks. And in the end, it helped. I was moved by that. So in times of war, I think it's worth remembering good things that people do for each other. And we do a lot of good things for a lot of people across the globe. So in the pandemic, there was this concept of, and we still have it, equity in the healthcare system, equity in schools. Now, I feel that, equity or equity of outcomes is a sense of, immorality to it to a certain extent. I'll explain. People who support equity of outcomes will view it the opposite way. But in my opinion, in some ways it resembles communism, where you try to make everyone equal. And let me give you an example. Imagine a classroom of children with a healthy teacher, and all the kids are healthy, and the parents are young and healthy. Do those kids need to shelter in place? So if those kids go through school normally, they have an advantage over kids who had to learn remotely, perhaps because they're being raised by elderly grandparents or because their teacher was elderly and at risk of COVID. So the thinking becomes everyone has to be the same. There has to be equity. But there was other reasons for sheltering in place, but this was part of the thinking, at least in certain states. Many people remember this, jokes like this. Let's watch this clip.
Vaccine rollout. Is that working? Joining us is someone who just received the vaccine, O.J. Simpson.
How's it going, gang? Great to see everybody. I don't get out much, so this is fun.
So, O.J., you got the vaccine?
Yep,
Teachers can't get vaccines, but you did?
that's correct.
People with long-term lung conditions can't get the vaccine, but you did?
Absolutely.
So, among the first 3% of all Americans given the vaccine was O.J. Simpson.
Hey, guilty as charged. About the vaccine.
All right, so the vaccine rollout, it doesn't work. Thank you so much for coming.
I'm someone with respiratory issues. If you watch my videos, you know that I have one lung. The other lung was removed 28 years ago. So when COVID hit, I had to shelter in place. So the original strain could have been fatal for me. O.J. Simpson got access to the vaccine a lot sooner than I did, yet he was far less at risk than I was. So they handled the vaccine rollout on the concept of equity. So they can verify your age by your driver's license, but they really can't verify issues with your lungs because people with money can just pay doctors. It didn't matter if I could just pull up my shirt and show the caved in chest cavity where I'm missing a lung. That didn't matter. It's equity. In 1997, I was diagnosed with mesothelioma and my right lung was surgically removed. This was attributed to asbestos exposure. Today, I'm an attorney and I fight for the rights of injured victims. My name is Bruce Slane, and if you or a loved one was recently diagnosed with mesothelioma, call me. I'd like to speak with you. Why did they lock down everything? If there was groups of people who might have been fine, and some certain states handled things differently. I'm not criticizing one state over the other. Let's shed some more light on this issue. Here's a picture of a freezer trucks next to a hospital near me. They didn't have room in their morgue for their bodies. So this was in the early stage of COVID. Now, people die in a pandemic. That's not the issue. The issue is a decent number of those people in those body bags, in the freezer trucks, there's a good chance that they likely died because they did not have the capacity to provide proper medical care because of patient overflow. So the medical system is kind of fragile, whether they want to tell you that or not. And let me tell you a story about one of those hospitals with the freezer trucks outside. And this was way before the COVID, and this is a medical malpractice case that was in the news. I was not the attorney on it. So a patient was dropped off by their family at the ER, and she checked in. And then the family thought she's fine. She's in the hospital. She's checked in. But the hospital was busy, and she was waiting in the waiting room. She closed her eyes, and then she died. Died a little time later, no one helping her. Well, eventually someone realized she wasn't breathing, and they tried to help her, and that gets noted in the record. When they performed the autopsy, the time of death turned to be about 7 or 8 hours earlier when she first got there. So she'd been sitting there dead in the waiting room all that time, and they can't cover it up because the chart notes when she checked in. And this happened at one of those hospitals. This was before COVID, so you can imagine what was going on when COVID was happening. So these things, this was happening across the country. So what do? We built tents, but there's only a certain amount of pulmonologists and critical care specialists and anesthesiologists who could treat these really serious cases. You can't just create more specialists instantly or tell them to work harder. Let's watch a short clip.
We work around the clock. I already work around the clock.
That's Harrison Ford telling Brendan Fraser, saying he already works around the clock. That's how these specialists feel. You tell them to work harder. You can't. They already work around the clock. So here's another memory of COVID theater. Shop workers, sometimes nurses taking your temperature with these ridiculous things. And the temperature shows up, 75 degrees. Great. You're hypothermic. Your heart will stop soon. You can come into the doctor's office now. Or it's ridiculous. The thermometers didn't work. They weren't meant to be used for that, but they did it anyway to stop the spread. So it was ridiculous. So here's a clip from Dr. Fauci. Now, I did a separate video on this commercial by itself, but let's watch what he has to say briefly.
People who are sick should stay home. You don't go to an emergency room. You don't go to a clinic.
Oh, so if you're sick, you stay home. You don't go to the emergency room. You don't go to the clinic. You just stay home and you die. There's people who did not listen to him, and they lived. So this is what was going on during COVID. Not to bring up bad memories, but it has to be confronted so we don't have this again. Here's AOC getting her vaccination. She's a politician. She acts with many other people because of her job. But state vaccine rollouts, politicians weren't included in that rollout. So federal politicians simply got the vaccination if they wanted it, when they wanted it. They didn't really had to pass a law or issue an executive order. I mean, it was built into the law itself, so to speak, is well, at least that's what they argue. So they were going to be in first in line anyway. I won't even go through the media cover-ups. If you lived in New York, you'd experience the vaccine passport system called the Excelsior Pass. And what is that a pass to? To move around in your own state? Now, at the same time, you're in a situation where you have people who lost their taste, they have a fever, and they're saying to themselves, I can't miss that wedding. And they go to the wedding and they infect a bunch of people, and then people die. Nothing happens to that person. Nothing. They weren't thrown in jail. But if you drank a couple shots of vodka and drove down the block and no one got hurt, you go to jail, and rightly so. So there's this economy, this state where people are being treated differently, and there's lessons to be learned. So sometimes I watch Tucker Carlson, I hear him say things like, we need to stop COVID vaccinations.
Stopping the recommendation of mRNA shots to children and to adults. But
I have to laugh because I get the vaccine twice a year. When I got COVID in the past with only one lung, and before when I did not have a vaccination, felt like I was going to die, and I probably was close to meeting my maker. But it's rough with one lung, and I have other medical issues related to that. When I get vaccinated, if I get COVID at all, I don't even realize that I have COVID. It's so mild. So, and I've been extensively exposed to COVID over the past. So according to some people like RFK Jr., people used to be healthier in the past before all these medications. Well, for someone like me, he's probably right. Now, if I was, not because there was less medications, if I was born in 1880, I would have 2 lungs because they weren't putting asbestos in every damn thing back then. So we live in a world with toxic materials and asbestos. It's the world we live in. Thanks for joining me. Please hit like and subscribe. I'll see you on the next video. Thank you.